Spotlighting Hawaii's leaders.
We want to bring in Governor David Ige.
Good morning, Mr. Mayor.
Lieutenant Governor, good morning. Thanks so much for joining us. Mayor Derek Kawakami.
Thank you so much, Senator, for being here.
Spotlighting the issues.
Where is the virus right now in our community?
How much is this overall going to cost the state?
How are you responding to the community's concerns? Talk about the level of citations that you guys are writing.
Spotlight Hawaii with Yunji Denise and Ryan Kalei Suji on the digital platforms of the Honolulu Star-Advertiser.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.
Well, happy Aloha Friday. Thanks for tuning in this morning. I'm Ryan Kalei Suji, joined by Yunji Denise, and this is Spotlight Hawaii on the digital platforms of the Honolulu Star-Advertiser. This morning, we are focusing back on COVID-19 as well as other things that are happening here in the state of Hawaii surrounding the health of our community with a guest that always has a lot of information and has a lot to share.
That's right. We are joined this morning live with the Director of the Department of Health, Dr. Libby Char, is joining us. We want to talk about monkeypox, Red Hill, but of course we're going to lead off with COVID this morning. Dr. Char, thanks for being here, and tell us, how are we doing as a state when it comes to COVID?
Good morning. Thanks for having me. As a state, I think we're heading in the right direction. I know a lot of us wish that COVID was done. Unfortunately, it's not quite done with us yet. But we've seen decreases in our case counts over the past, I think, 4 or 5 weeks now. So we're trending in the right direction. The percent test positivity is coming down. And we just hope it continues coming down like that. A lot of predictions on the mainland for a surge in the fall. And I think a lot of that has to do with people being indoors in the winter, as the weather gets colder and being in close proximity. So I'm hoping that we can avoid a spike like that. But we know that if it's happening across the rest of the U.S., it's likely to come here as well. So just hope that the trend keeps going down and that we stay in a really good place.
One of the things that you've mentioned on this program before, as well as Governor Ige has also mentioned, is monitoring our hospitals, the hospitalizations, as well as just the overall capacity of what they're able to handle. We know that there has been a surge, and not necessarily all related to COVID-19, but other things that are happening. What are we seeing in the hospitals in terms of capacity and staffing and personnel overall that are able to help those who are suffering from COVID-19 and other reasons why they're being brought into these hospitals?
So we track the hospital numbers carefully, and it's gradually coming down. So we know the hospitals themselves are really, really full right now, but it's not with COVID patients. There are only about 100 COVID patients statewide in the hospital right now, as opposed to, the 400 plus that we saw during the peak of some of the other surges. It's been just gradually coming down, but the hospitals themselves, if you look at the number of patients admitted to the hospital, it's really high. One of the things that the governor did recently to take action was that he issued an emergency order that allowed rule changes temporarily for those nurses that have licenses in another state and are in good standing to be able to come into Hawaii and practice, as long as they're practicing under, they're working for a hospital or a clinic or something like that. And that's helped tremendously. I know a lot of the hospitals were reporting that their staffing was really stretched, and that hasn't been the case so much recently. Still very much a concern, and we are watching carefully, but so far we're absolutely able to take care of all the sick people that need care in Hawaii.
I want to ask you about schools, because we know this was a big change with kids heading back on August 1st. They've been in school about a month now, and masks are no longer mandatory. Have we seen outbreaks at schools? There was a lot of concern that these would be dangerous for students and their families if they were not masked. How has that impacted the COVID numbers as far as you can tell?
Yeah, but we've been watching that carefully because we sort of expected, just by virtue of bringing back, these thousands and thousands of kids together, that we would see a bump. So far, so good. We haven't really seen a lot. There have been some small clusters here and there, as you would expect. But I think, the schools are a reflection of the community. And so at this point, we feel like there are enough people in the community that either had COVID or have been vaccinated or have been exposed that, and people, I think, are still, by and large, being careful about the decisions that they make. So we haven't seen big outbreaks in schools, thankfully, and I hope it continues that way.
when we look at some of the other things and some of the other areas that are infected by COVID-19, one of the things that the Department of Health has continued to beat, the drum that they continue to beat, is getting booster shots. Of course, for those even who haven't even been vaccinated, to get vaccinated. What can you tell us about where we're at as a state with booster shots? And there are some out there that are waiting for the super booster that covers more of these new variants that we're seeing. Can you provide any updates about that as well?
Yeah, and thanks for pinging on that, because we are all about still encouraging people who have not yet been vaccinated to please get vaccinated. And if you've been vaccinated, please make sure you get whatever booster shots you're eligible for. So at this point, I'm just looking at my numbers here. We are 77% of our population has had at least the 2 shots. Almost 45% have gotten boosted, and then about 11.5% have gotten 2 boosters. But keep in mind that only those 50 and older and those with immune compromise are eligible for the second booster. So we continue to encourage people to please go get vaccinated and boosted. Novavax came to town. We have it available statewide for those who didn't want to get an mRNA vaccine. Here's your chance. It's a more traditionally made vaccine, and it's available statewide. And I think the other thing is that there's a lot of chatter about the bivalent vaccine that's going to be available in the U.S. The timeline is really moving up. So we're hearing now that it's both Moderna and Pfizer have submitted for FDA EUA. And if that goes through, then CDC's ACIP committee should be meeting September 1st and 2nd. And if they approve it, we could see vaccine being shipped as early as, a few days thereafter. We have placed pre-orders already, wave 1 and wave 2. So this week we submitted our pre-order, and then next week we'll submit our wave 2 pre-order. So again, we expect to have it statewide as soon as we can. And I'm hearing at this point, it should probably be early September. So for sure, that's going to be available, not just 50 and older. That should be available to everybody 12 and older to go get that booster.
And just so people are clear, the bivalent vaccine, tell us exactly what that is, what that hopes to cover, what kind of protection we're hoping from that.
So thus far, the COVID vaccines, COVID boosters have been pretty much for original strain COVID. And we know that that's still been very protective against severe illness and death, but you can still get infected now, because as this virus evolves, the mutations that it picks up have been able to, it's better at evading our immune system. And so we know that people are still getting infected despite not getting really, really sick. Well, it sure would be nice if you didn't even get infected. So to the extent that we can, the bivalent vaccine is going to be that original vaccine. And it's also going to have a component that's for Omicron and elements of BA.5. And so with that, it's thought that we will not only be protected from severe illness and hospitalization, but also help to minimize even getting infected or getting reinfected. So it should kind of beef up those neutralizing antibodies.
And just to clarify further, for if and when that becomes available to the public, how will the department be dispersing that? Who will be the first to get that? Is that just going to go through the normal parties and the distributors? Because we have heard from the governor saying that as these federal dollars wind down and as we enter this other half of the pandemic, some of the free resources that were once made available will no longer be free. What is that? Is this booster and vaccine included in these services, and how will that be distributed?
Yeah, so we're not receiving any additional federal funds. I think Congress a request went to Congress for an additional $10.2 billion for COVID response. And as far as I know, to date, that has not been approved. So we do have some funding still for COVID, but we're not getting anything additional. When the vaccine comes, we will use it to the best of our ability and get it out there, but it's not going to be enough for everybody up front. So I think similar to when we first had booster shots and vaccine, we're going to have to figure how best to vaccinate those that really need it first. There's so many unknowns still yet. We're still waiting to hear whether the CDC is going to put any sort of restrictions on it, or if they're just going to leave it up to the states, or how that's going to go. We are not planning to do massive vaccine campaigns as we had done previously because we don't have any funding for that. What we're looking at is to get it as widely dispersed as we can into healthcare in our community. So to make sure it's on every island, that people have access to it, that they have easy access to it, you know, close to where they live, close to where they work, so that it's convenient. Our first order, I think, trying to remember how much we ordered now. Pull it up on my notes, but I think we have, it was 10,500 doses of Moderna, and I think we got 27,300 doses of Pfizer, somewhere in that ballpark, for waves 1 and 2 combined. So we should have about 38,000 doses roughly, and that's going to be for the initial waves 1 and 2.
I want to bring in this question from Heidi. We know that flu season is going to be upon us, or perhaps already is. I got my flu shot earlier this week. She's asking, will the bivalent vaccine also have the flu vaccine included, or will a separate vaccine for flu be needed? There had been talk of perhaps at some point combining the two. My understanding is that this is not including the flu vaccine. Can you clarify that?
Yeah, Heidi's correct. What it's going to be is the bivalent for the COVID refers to 2 different strains of COVID. So flu shot will be separate, but that's a really good point. Please go get your flu shot. You know, we're heading into flu shot, usually about September-ish. Go get your flu shot this year, because we're seeing more and more of that as well. Less people wearing masks. In general, we're going to see more and more respiratory illnesses as people are out and about, not wearing masks, and in more populated settings. So please go get your flu shot.
We're seeing a number of questions as well coming in here about the deaths that are being reported by the Department of Health. Some asking if you're concerned with the steady death count. What are we learning from those individuals who are unable to survive through COVID-19, and what you're attributing to some of the deaths that we're seeing, and how the state is and the Department of Health is maybe learning or gathering any information that they can about these fatalities due to COVID-19?
I think for the most part, when we look at those numbers and that data, I think it tends to be people who are older. And I think it's people who have a lot of other health illness. And so I think that, coupled with, you know, then having a COVID infection on top of everything else, that the outcomes are not so good. We definitely, you know, if there's a way that you can prevent a death, then we should be doing that. And that's why we are really, really pushing the vaccination. And if you're somebody at high risk, or even if you're not, just making good decisions and knowing that certain settings are going to be more risky than others. But yeah, we would like to see no deaths related to COVID. It's been pretty steady. I think we're still the second lowest death rate in the country. But we don't want to see anything from that.
There's a clarification question here from Liz. Does your order include pharmacies, or do they get separately those close to 40,000 doses that you were outlining there? And is that how long is that supposed to hold Hawaii, that initial dose? You know, is that a monthly expectation that then we would get more? Is it a weekly? When can we put in sort of the next order, if you will? And does that include pharmacies, to Liz's question?
So the pharmacies and the federally qualified health centers have been able to pre-order doses on their own. So that's not coming out of that number in the state allocation. So that's a good thing. So we'll have more doses than that in our state. Historically, I think we had been seeing allocations. I think the expectation, and again, this is a lot of unknowns, I'm guessing that we'll probably have access maybe every couple of weeks to order another bunch of doses.
We're also seeing questions about long COVID. This question coming in from Grant. Are there treatments for long COVID? Have we seen an increase in long COVID patients here? What can you tell us about what the Department of Health is also learning about long COVID and the impact that it's having on certain groups within the population of people that are infected with COVID-19?
You know, it's a really interesting topic, and one that we don't know enough about yet. I know there are some clinics running at some of the different healthcare centers to look at long COVID. I'm not familiar with what the exact numbers are, but it runs the gamut from people just having lingering symptoms for a long time to those who have really debilitating long COVID, and including things like, memory fog and not being able to return to their pre-COVID life. And so it can be really, really devastating. And I think, that's one of the things why we are still pushing so hard to prevent getting infected in the first place. Because if you're not infected, you're not a candidate for long COVID. And you don't know who's going to get long COVID. You don't know how that's going to turn out for you if you do get a COVID infection, whether you're going to be one of the people that gets long COVID. So to the extent that we can prevent it up front, I think that's a worthwhile thing to do. There are some clinics now. I think we really won't have a lot of answers until, we see more time elapse and we can really look back at, a year and 2 years and 3 years. It's not worth saying, I'll get COVID now, it's not so bad. You don't know if you're going to end up, be somebody that ends up with long COVID. We're treating it symptomatically right now. I don't think there's any specific overall treatment for it, because I think it can manifest in different ways in people.
We're getting a lot of great questions, and please, audience, keep them coming. This one from Anne Marie saying, what's the status on COVID monitoring via sewage? We've heard a lot about this program. Can you tell us about the state's role, where this is being done, and how it's going?
And so there's been a lot of confusion and misunderstanding. The Department of Health actually has been participating in wastewater testing and using sewage. What you do is you use the wastewater as a surveillance tool. And so it doesn't tell you about specific people, but if you can look in aggregate, you can see if viral load is trending upwards or downwards, and you can also do genomic sequencing. So we have been participating in wastewater surveillance testing, I don't know, towards the beginning of this year. In March, we picked up wastewater that we could identify that there was some BA2 in the wastewater on Kauai. And that was before anybody had been diagnosed on Kauai with having Omicron BA2. So it's been very helpful for us. We have been watching it. The good news is that the trends right now seem to mirror what we're seeing in the testing percent positivity. And so we're not expecting any, big spikes or anything at this point based on what we're seeing in wastewater as well as testing. We have coordinated 15 wastewater treatment plants around the state and sending in data. I think there's 5 on Oahu, 4 on Kauai, 3 on Maui, 3 on the Big Island. And so we've been sending it through the CDC program, and there's stuff posted on the CDC website. The difference is that we're not running the samples here. The samples are being sent to the mainland. And we'd like to be able to run it here, because I think that would really shorten the turnaround time and get us some data a lot faster. And so to that aim, we had people working on the program, 2 people left. So things were paused a little bit as we tried to hire others. And thankfully, we've had 2 other people were really, really hopeful, and they started this week. So we're hoping that we're close to be able to running things here ourselves. But we have been participating for quite some time.
And just to follow up, so those individuals who would be doing that testing and surveillancing and research locally would help to expedite the timeline in which we could get more information. And again, they would be monitoring in charge of all of the statewide testing as well?
Yeah, I think we'll continue to participate with the CDC program, but I think it'll just give us more tools to be able to do things locally, to run samples locally, to do some of our own tests. And this is more something that deals with infrastructure as well, because the wastewater is not only to look at COVID. In New York, you hear about them picking up polio cases. The possibility is out there that we could at some point, start looking at monkeypox and testing for other things within wastewater to do surveillance, looking at antibiotic resistance. I mean, there's all sorts of things that can be done using this platform of wastewater testing. So we're not there yet, but we would like to build a robust program beyond just COVID.
You mentioned monkeypox. I want to move on to that right now. Yesterday, it was reported 4 new cases in our community. Where are we seeing monkeypox, and what is the vaccination program right now in terms of outreach and contact tracing? Sort of how's our handle on this virus in our community right now?
So I think we definitely have monkeypox in our community. We do have some community spread. I think overall we're doing well. and the risk to the population at large is very low. What we're seeing, I think there are like 17,000 cases now in the US as of yesterday, and we have 22 cases in Hawaii. So just to put things in perspective, that doesn't mean that, that we're letting up on it or we're not going to chase it aggressively. We would like to do our best to see if we can contain it, and make sure that the population that's at risk is aware that they're at risk and does something about it. And so what we're seeing is that we're primarily seeing it in some disproportionately affected communities or disproportionately impacted communities. And so we're trying to make sure we get vaccine out there. We're seeing it primarily in gay and bisexual men and men who have sex with men, but anyone can get monkeypox. It's really about being in proximity and behavior and contact. So we have reached out to even things like University of Hawaii. Dr. Campbell has had conversations with them just to make sure that the education is there and that the awareness is there. We need to be vigilant, as we are for all infectious diseases. So we're doing really, really strict contact tracing. So if we hear of a case or we identify a case, really, really good contact tracing, so we know who else was anybody else exposed, where, and get more information and be able to strategize a little bit better. So testing is now available. Any physician can order a test. There are 5 big mainland labs that are working with all the local labs. Tremendous capacity for testing is out there. I know that was a problem really early on where it was only available through the public health labs. It's commercially available now. The big thing right now is for vaccination. So we are trying really hard to make sure that there is vaccination. We had very, very limited amounts. And so we were using it for people who had actually been exposed to somebody with monkeypox. And as we receive more vaccine, we're gradually expanding that. So we're at the point now where people who are at risk should go get vaccinated. We're doing a pre-exposure prophylaxis. And we're trying to get it out there. We're working really hard with community partners. We want it to be in the community where people normally go and get their health care and deal with providers that are used to working with these populations to provide vaccination. But in order to jumpstart that, we held several large vaccination opportunities through the State Department of Health, through the public health nurses, and we set up some opportunities at Blaisdell. So I think we vaccinated just under about 2,000 people at this point, and we had roughly 2,500 doses. We recently got allocation and got another about 1,500 doses. So we're ready to go. We have appointments available for those that need it through, I think through the end of October.
And again, this would be, so right now with the vaccination plan, it's really for those who believe they have been exposed to monkeypox, or for those who feel that they are at high risk. It's not necessarily available for just anyone who wants to protect themselves against monkeypox at this point in time.
Correct. And I think the community at large really doesn't need to worry about it. The risk is very low. We're primarily seeing this disease affect gay and bisexual males, men who have sex with men. That's the population. If they're at risk, to please get vaccinated. If anybody has questions, feel free to call us at the Department of Health, and we can, discuss whether or not people need to get it or should be encouraged to get it or not. We've had a lot of people that just said, "Oh, I'm not at risk in any of those populations, but I just thought I should get protected." You don't need to worry about it. You don't need to get protected right now. It's not a risk to you. So really, we're trying to get a certain population that's at risk to go get vaccinated.
There's some questions in the comments about Red Hills, so we want to ask you about that in the few minutes that we have left. We know that the Department of Health had rejected the Navy's plan for decommissioning the facility or defueling it, based a lot, I believe, on timing, just that it was going to take such a very long time. The Navy said that they would present a new plan, I believe, by the end of this month. What are you hoping to see in that plan, and what have you heard of it so far?
So I think the reason that the plan was rejected was just that it didn't have enough specific details in it for us to be able to approve it or not. And so we're disappointed that the timeline is so long, but I think we also are very aware that this is not an easy task. And what we really need to do is to make sure that the defueling is done safely. I think that would be worse than anything if there was another large spill. So it needs to be done safely and expeditiously. What we're waiting for is the Navy is going to submit an updated version that has more detail in it. And we're hoping that it addresses the concerns that we had, and also that it's that it has enough detail that we can approve it and that we can get started on this. We have a real sense of urgency that there's fuel sitting in these large storage tanks and in miles of pipeline, and we would like to remove that risk from contamination of our aquifer.
As we wrap up here, I just wanted to ask you, as someone who is leading this department, your time here as a director, of course, you came on board mid-pandemic, and you are a part of the governor's administration. The governor's, has a few more months left on his clock as the governor and leading the state, but as someone that falls under his appointed cabinet, your time as well could be coming to an end here. Wanted to ask, your future plans and just maybe what you've learned about being the head of this department, and maybe anything that surprised you the most of having to lead during this time.
So I'm very much looking forward to the end of the term. I think my plans right now include a lot of sleep for a week or two, and after that, I don't really have any plans yet. I'm sure something will pop up. I've learned an awful lot in this job, and I've also made some really good friends. I think one of the interesting things to me is just to really get a much better appreciation of the value of public health. I, like most people, don't have a background in public health, and I think it's been a real eye-opener that when public health is functioning well, it's invisible. It's in the background. We don't think about it, and yet that's what's protecting us day to day. To have clean air and to have clean drinking water, and to be protecting the reefs and protecting our environment. And we just don't see that. It's in the background. So I think the importance, as was highlighted by COVID and by Red Hill and by Monkeypox and by Legionella and by all these other things we're dealing with, is really that public health really brings value. And, you talk about an ounce of prevention. That's the prevention, is the public health side. So it's worth the investment in it. There are an awful lot of good people in this department that have been working nonstop for, the past several years now. It'd be nice for them to be able to take a little bit more of a break. And I know we're able to do that here and there now, but there's just a really lot of good people here. People have been working hard, and my heart goes out to them, and really gratitude for being able to be a part of this Department of Health team and part of the governor's team. But I sure am looking forward to being able to sleep for a bit.
Well, I'm interested to know, of course, we have an election to get through in November, but if asked by the next administration, would you consider staying on in your role?
Oh, I don't know. I'm really looking forward to catching up on a little bit of sleep, but one of those things, I'll deal with that as the time gets closer to the end of session.
Well, we always appreciate you taking time to join us on this program. As highlighted by the number of questions that come in, you always spur on a lot of discussion, and there's a lot of interest, of course, in public health as it affects so much people in our community. But we always appreciate you coming on and addressing the questions from our viewers and our community and the updates that you provide. So thank you so much, Dr. Char. We look forward to our next conversation in the future.
Yeah, thank you. And thanks to the community for being very supportive and being good partners in this. And, we're all in it together. So much gratitude.
We appreciate it. Thank you so much.
Thank you.
Interesting to hear from her, especially on that bivalent vaccine and the orders already put in. We're still waiting for final approval, of course, on the federal level. But once that does happen, she's saying it could happen as early as next month, that we could see doses arriving here to Hawaii, close to 40,000 between the different providers that are making that vaccine. They have to figure out who gets it first, but it will be presumably for those folks who are 12 and older. So wide eligibility, unlike that second booster that has been limited to those over the age of 50. That number that she laid out does not include the pharmacies and other providers who are able to order some vaccinations on their own. So she does say that we should expect a large scale vaccine coming in, and eventually everyone should be able to get it. We're going to wait to hear more about who will be eligible first, but definitely keeping an eye out for that because it will offer a lot more protection than the vaccines we've had in the past.
Yeah, and a lot of people have been asking about that. I mean, we've seen it in the comments over the past few months about people asking about that second booster shot, if they should wait for this so-called super booster that will include some immunity, of course, from what science has learned from the Omicron variant and being able to incorporate that. She did make that clarification, though, that the flu shot is something completely separate. And that is also something that she continues to encourage the community to do, is to get those flu shots when flu season begins, because they are likely to see an uptick with mask wearing reduction happening within the community, more spread, more events. Of course, the flu continues to be something that impacts the Department of Health in our community. And so Dr. Char also encouraging people to get that vaccine as well. But we also heard some optimism from her, which is something that we don't always hear from Dr. Char. From all those times that we've been speaking to her over the past year or so, of course, there's always a lot of concern with COVID-19, but saying that the state is in a much better position right now when it comes to COVID-19. Our overall numbers, hospitalization as it relates to COVID-19 patients remain low, as well as what we're seeing in the schools.
Yeah, that was some really good news there, that she said they have seen clusters, but overall they are not seeing widespread of the virus in the community in school. When it comes to schools, there was a lot of trepidation about the decision to remove mandatory masking from students on DOE properties. But even though that is not the case, they have not seen huge spread in the schools. And so we're thankful for that. Interesting to get her update on monkeypox and the vaccine there. They've vaccinated about 2,000 people so far. They do have vaccine available if you are in what's considered a high-risk group. So definitely go ahead and talk to your provider and see if if you're eligible for this vaccine. She's saying please go out and get it, because it is not something we are seeing community spread, and it's not something we want to see accelerate in our community. And then Ryan, lastly, she did touch on Red Hill.
Yeah, we heard the update about what the Department of Health continues to do in their relations working with the military to of course, we've heard from public officials, from our leaders, that the timeline that was presented by the military of the 2 years was something that many were not happy with. And so the State Department of Health continues in their conversations with the military and the Navy to see and ensure that the defueling happens. But not only that, but it's done in a safe manner that will continue to protect the public at large. Always great hearing from her and getting an update, saying she's looking forward to some sleep when her time is over, as this administration comes to an end. We still got a few more months still, so looking forward to our future conversations with Dr. Char. Always great talking to her. Someone else that we always enjoy talking to is Senator Brian Schatz, who we'll be speaking to next week.
That's right. We've got a lot to talk about with the senator, including, of course, Red Hill, but also the Inflation Reduction Act and how that could impact Hawaii, and talking about the decision with Roe versus Wade, the national implications of that decision, how that could affect policy on a national level and here in Hawaii, along with, COVID and a number of other things. And also interested to get his take on the election, the primary election, what he thinks of the candidates. Of course, he will have someone else to be working with him in Washington, because Kai Kahele, of course, gave up that seat. So he will have a new member of the delegation eventually. And so getting his thoughts on that. So plenty to talk about with the senator. Please do join us right back here on Monday, 10:30 on Spotlight Hawaii. Have a great weekend.
We'll see you then. Aloha.
This episode of Spotlight Hawaii is brought to you by Long's Drugs.